The views, comments, and opinions of the following program do not necessarily reflect those of Morris Media Studios, MorrisMediaLive.com, or its affiliates. Listener discretion is advised.
Welcome back to another edition of Health from the Inside Out. I'm your co-host, Dr. Jason Kelberman, chiropractic kinesiologist, and my wonderful co-host, Dr. Suzanne Cutter, surgical oncologist.
Hello.
Today's show, we're going to just recap a little bit about weight from last week for 2 minutes to segue us into the topic for today. And before we do that, I just want to say thank you to everybody who called in last week and jammed up our switchboards. We learned a lot. Please use our email address for any prizes that we give out, because that's the easiest way for us to get it to you quickly without having to run around town, etc. Right. So that email address is Dr. Kelberman, DrKelberman at WWC, stands for Westside Wellness Center.care. Okay. My office number, 310-268-8008. That's the information you need. Dr. Cutter can be reached, 213-261-7100. www.curetology is her specialty.
The study of cure.
Exactly. So what's the big deal about diet? Why is everybody making such a big deal about it? What does it lead to? The topic for today's show we're going to segue into is exercise, injury, and joint rehabilitation, okay? And to start off the show, I just want to say that everything in our human world is best prevented than treated after the fact.
That is so true.
Right?
So true.
So let's talk about prevention for just a second, because we did talk about weight reduction and diet. The whole concept with eating right for yourself is to reduce inflammation and to allow the body to do what it does best. Mm-hmm. Mm-hmm. And when that runs amok, something in the body goes awry. And for many of us, it's our joints. Right. And so a bad diet can cause joint problems because your body is inflaming those joints because it's not doing proper repair work at night when you sleep. Yes, that's right. You're supposed to be repairing your body at night when you sleep. So if you're not sleeping, that alone could be part of your health issue. Sleep is very important.
Contributes to aging, contributes to obesity,
right? Contributes
to everything. Sleep is valuable. It's like,
and I know you've heard, "I'll sleep when I'm dead," but that's only if you're planning on living for 40 years. Okay,
but I actually say that sometimes. Like sometimes you want to have fun.
Okay, well, there are times in our life where that's appropriate. Yeah,
and your friends are like, "Oh, I'm sleepy. It's 9:00." It's like, come on, get out of the house sometimes. Right. And that's part of what contributes actually to overeating. People who don't have a really good balance in their lives and they're eating for some type of contentment. So, there they are having this diet that's not ideal, overeating, and then contributing to the inflammation. And the next thing they know, they hurt their knee.
Exactly. No coincidences there. By the way, the information provided here is educational only. It does not replace actually seeing a doctor and getting specific exams and consultations.
'Tis true.
Okay. So I think what we learned last week was we are the fattest nation on the planet. And it does.
Bugs.
Yeah. and it impacts our health, and it increases our health care costs.
Indeed.
And so part of the problem that we're having is not just that insurance isn't covering everything anymore, but that everything is overloading our system that we want to get care for. And to that extent, we need to take responsibility and prevent disease rather than wait till we are diseased.
That is one of my favorite words, which is actually the responsibility part. I always talk about that with my patients. Like, look, I have a role, you have a role, and I even give the family a role. You have to take responsibility for your health. You know, we're not here to fix all the damage, right? You do drugs for 10 years, you smoke for 30 years, you drink for 15 years, and you say, look, you got to figure it out, fix me. It's like, well, you know, I just left my magic wand at home, and all I have is, you know, some medical knowledge and imaging. You know, you have to do your part too.
And so when you seek care, most of the time what's going to happen is they're going to look at what the most critical part is.
Yes, because time is limited.
Yeah,
you know,
exactly.
those visits. Yeah,
I saw a patient the other day who was in very serious health concerns.
Oh, no.
In the worst anxiety PTSD that I have ever seen.
Oh, that's too bad.
And one of the things that popped up is she had an infection in her mouth, and she had put off taking care of it. And so her partner and I had a long talk about that, and obviously she was anxious. So she's an anxiety type person, so she's anxious about getting the tooth taken care of. And so I suggested that they do a general anesthesia rather than a local to avoid the anxiety. It's like, why we have so many wonderful things, you know, to achieve of the goal with these days.
Yeah,
why suffer?
True. That's true.
Right?
Why suffer?
So she could go under general anesthesia, get her tooth taken care of, and move on, because infection is one of those priority things in our body.
Right. And the body just, you're right, it prioritizes that over everything else. And so if you think of rest and digest or fight and flight, that's in that fight and flight category where you just shut down immune system, your digestion, everything, just for the sake of fighting that infection. So
coming down today, you know, I always review my thoughts during the week and then at the last minute again. And dental care is very important.
Yeah.
You can be doing everything right, but if you neglect your mouth, you're going to have issues. You're going to have bacteria pouring down into your system. It's going to affect your liver, your kidney, your intestines, whatever.
Can I tell a sad story about dental care?
No.
Why?
We want to be optimistic.
But we want to talk about reality,
You can't tell
too.
Dr. Cutter no, by the way. Just, go for it. Go ahead.
Here's a sad story. This is actually, it's sad because this is someone that I knew and really cared for. Older gentleman who was kind of like an uncle to me. He was the best friend of somebody who's a great mentor of mine. And he came to town with some heart issues, right? But unfortunately, he had really poor dentition. His dental care was terrible. He had plaques and, you know, just, his teeth looked terrible. So in any case, after getting some initial cardiac care, he decided to go get his teeth cleaned.
Yeah. Uh-oh. Oh,
Exactly.
I hear where this is going.
You know where I'm going with this. You guys, I'm not kidding you. After he got his teeth cleaned, because his teeth were in such poor condition, you know,
it broke all hell loose, didn't it?
It did, because your teeth are a direct pathway to your bloodstream. And so once they liberated all that bacteria that was trapped in the plaques, he had one problem after another.
Yeah.
He developed a vegetation on the heart. Then he ended up developing a systemic infection. Then he developed an infection in the leg. He ended up having to get an amputation of the forefoot, then an amputation of the foot, then an amputation of the leg, and then he died.
Oh, my God.
This is all because of poor dentition.
Right.
Intelligent man. He was an attorney. He was a fine human being. He just kind of had gotten to a point where he was getting distracted by some other things. So don't let life distract you, family, what have you.
Don't go 15 years without dental care either.
Yeah, take care of yourselves and take care of your teeth.
So that scenario could have been modulated by A, only doing a small area at a time.
Yeah.
B, using a rebreathing device and a recirculating device so that they sucked out more than it went down.
Exactly.
Or prophylactically putting them on antibiotics or whatever was appropriate beforehand.
And I couldn't believe that I mean, I just thought, wow. I mean, it just seemed so obvious to me. I mean, as soon as he started having problems, I'm like, I know exactly what happened. This is all the dental care.
But because he's never had those issues, no one was thinking ahead.
Nobody was thinking about it.
But that's very common.
Yeah.
I've actually handled several cases like that. They did better, so it's not as sad.
Thank God, yeah.
But I've actually had a couple of cases where in order to fix their knees, I had to fix their mouth. So
how did you know?
How did I know?
How did you figure that out?
Well, this was actually interesting because the woman had dentures. And you would think, wow, can't be any problem. They're dentures. But they're 40-year-old dentures. And the mandible and all the bone had shrunk down. So you can't see me, but when you have that happen to you, your face changes. Kind of looks like that a little bit, you know. You can't see it, but you know what I'm talking about. Your cheeks you start to look like the person that you thought was your grandfather, and you talk a little differently. I think
we all know what it looks like when things are a little collapsed around there. Yeah, but
so since I'm a kinesiologist, I know how to connect the dots.
Right.
So I had trouble.
What is the definition of kinesiology?
Kinesiology is the study of the motion of your body, what moves your body, or its muscles.
Right.
So
and the interrelationship.
Exactly,
okay.
and how they react to spinal nerves, acupuncture meridians, lymphatic, blah blah, gait mechanism, all that.
Wholeness.
Yeah, everything is related. Everything
specialty.
connects, which is why you need to exercise. We'll get back to that in a second. So I was having trouble strengthening her quadricep group, which is one of the most important muscles that connect to the knee and your patella and so forth.
Quads are where?
Yes, they're in your upper thighs, and they connect to your knees.
And they're on the front.
They're in the front. Yes, thank you. And so what I did was I took a couple of tongue depressors, and I put them between her teeth and had her hold that tight, and her strength returned.
Wow. So
what that does is this. So your teeth open and keep open the space that's supposed to be right here at your jaw joint. Okay? In the same way that a disc of the spine holds the spinal segments open, the teeth in the mouth hold the joint in proper alignment.
Okay.
And when you don't have those teeth, or when you have 40-year-old dentures that are too small, the joint compresses.
But what impact does that have?
Well, so it irritates both the joint and the acupuncture meridian around the joint, which is small intestine. Okay. So it can then bother things that are small intestine,
digestion,
or muscles on the small intestine meridian, and this kind of thing. And so if I put two blades in her mouth and her power came up, I went, oh, what am I going to do now? This was a few years ago. Good news was I knew some good dentists. They changed her dentures out.
Yeah.
And a couple of visits later, boom.
She was fine.
She was great. Not only did her knee get better, but she looked 10 years younger because that stuff came out of
beautiful teeth and dentures.
It was like a facelift.
So how often should the dentures get changed? Did they tell you, like, how often? Is it 20 years, 10 years, 15, 20?
I think it varies, and I think the new materials are probably better. I think I'll leave that to the dental world.
Okay.
If you get dentists, you should ask your dentist, how long? When should I have it checked? Do I have to get it relined? When do I need to remake them? Those are questions for the specialists, not me. Having
good, well-fitting dentures and things like that is really important because it also impacts the ability to masticate, to chew, and a lot of things.
Right. Now now that we're talking about dentition, I got to talk one more thing. I know but
this really is about joints, you guys.
Yeah.
We just
I want to talk briefly about root canals and incomplete procedures. Okay. Correct me if I'm wrong, but a root canal is the only time that we leave dead tissue in the body.
Not the only time.
What can you think of that relates to that?
Well,
if your skin dies, you want it out. If your bone dies, you want it out. What else would you leave in?
But surgically, so for example, let's say that a patient suffers a trauma, some type of a trauma.
We're talking scar tissue and that kind of thing?
I'm talking about a spleen. Sometimes, a portion of your spleen we say, the portion of the spleen gets knocked off, where it loses a portion of the blood supply for whatever reason, right? Or we have to embolize something. In other words,
But would you agree that it's rare that this happens?
Vessels.
It's rare.
Well, what I was going to say is sometimes it's more harmful to remove that organ.
Yes.
But the body will remodel it and reorganize it. The problem is if it gets infected. So I think maybe what you're talking about is dead tissue that might be infected or something like that versus which
is sometimes the case with root canals.
Exactly, this is like a sterile tissue, right? It's just dying, and so the body is going to remodel it. So don't get that confused between the dead tissue that's infected and not infected. Right. This is non-infected tissue.
Root canals was the best procedure that the dental world had for many years before implants became available.
Thank goodness.
So sometimes root canals fail, and they become porous and open to the myriad of bacteria that are in our mouth.
Right.
And that becomes infected, and that is a big problem. Sometimes because dentistry is expensive, people don't complete projects.
Interesting.
I did the root canal, but I didn't put the big crown on top of it.
Right.
Okay, I'm just going to give you my opinion.
Okay.
If you can't afford to finish it,
don't start it.
Either don't start it or pull the tooth out. You'll be much healthier pulling the tooth out, saving yourself a lot of money and grief, and doing an implant much later. Okay? That way you avoid infection and disease and everything else. Because to leave a tooth open, uncovered in the mouth is really a bad idea.
And that doesn't sound very comfortable.
No.
Although the nerve
but a lot
is
of
dead,
people do.
Still, yeah.
A lot of people do. And this can lead to many other problems, both infectious and neurologic. Okay, so that's all I wanted to say about that. Okay, so all of you out there, good dental care is important.
We need to have a dentist on the show one day.
We could do that. We could bring a holistic guy on or a non-holistic guy on.
That would be
cool. We could definitely do that.
I vote holistic.
Because that's an important part of our health. Okay, and it's something, as one of my dental friends said, too bad our teeth weren't designed to last our whole life.
They really weren't?
Meaning there's very few of us who go our entire life with no fillings or, the need for anything. Intervention of some kind.
That's because we're naughty, though. It's not because it's not the teeth.
We're going back to sugar here, folks, because it's all about sugar.
And we do bets and acids and, a lot of, or we don't brush teeth before we go to bed. I know some people who never brush their teeth before they go to bed. I just can't believe that.
That's 8 hours of whatever you ate left there. Okay. So that's our recap.
Was about dentistry, which we didn't talk about last time.
It's about why your diet's important, why you want to keep inflammation from building up. Since we last had our liver show.
Oh, that was fun.
I've spent a lot of time with some docs who specialize in liver rehabilitation through functional medicine.
Ooh, loving it.
And they are doing some phenomenal work.
Oh, my goodness.
So I stole some of it, which is one of my specialties.
Okay, but I'm feeling like our joints are going to get the shortchanged again, and I really want to talk about these knees and things. Okay.
But I wanted to finish the concept of inflammation because a lot of it has to do with what happens to our liver.
Okay.
So after that's somebody's knee, not mine. We're going there in a minute, but just to let you know that liver rehabilitation is possible without using drugs. And I actually just came up with a trio combo product that they're all recommending all in one, so you don't have to take 3 or 4 different things at the same time. So if you're interested in that, call me at Dr. Kelberman at wwc.care. Okay, onward. So what's the big deal about exercise? Why do we keep pushing exercise? For all of you people who don't exercise, you're the ones who I want to reach. Okay? Yes. I want to reach you first. Well, the ones that are exercising, you've already had a taste of why and how good it feels and so forth and so on. For you couch potatoes out there, we want to talk to you.
But I also want to talk to the ones who are making some exercise mishaps, some mistakes
we'll get
and things
there.
like that.
We'll get there.
I want to talk
First,
to
I want so why is it so good? What's so important? So our body is supposed to move. We were never designed to sit around all day long.
No, saber-toothed tigers need to be chased, okay? They do.
And what it does for us is it increases our circulation and metabolism greatly. Mm-hmm. We don't need to put any numbers on that. But if you're just sitting on your couch, your heart's only going to do so much. Your veins are going to bring back only so much just sitting around. But you moving and walking and, using your body does a heck of a lot more. So that's why it's important. We were designed to move. Our joints stay healthy when we move them.
'Tis true.
Okay? That's why exercise is important, because there's really no other way to do it on your own. You just got to move. So how many joints are there in the human body? Oh, too many to even talk about. We're going to just give you an idea of 2 of the most common joint issues, and then relate that to every part of the body. So there's a couple of slides we're going to do. We're going to meld it in a little bit. So instead of taking up the whole screen, you're going to see us at the bottom, And one of our graphics up at the top, if we can get them to hit that button.
Mixmaster.
There we go. Okay, so most of us, in fact, there's a statistic that says 8 out of 10 people will have foot pain at one point or another.
That.
That's a big number. Okay.
I believe that.
I think that the stat on back pain is like 60%, 55-60% will have some kind of back pain. And well, if you're interested in stats, that's not why we're here. You can Google that if you want the stats. What we're here is to open your mind up a little bit and give you some content, the content that you can use. So hit the next slide for us. So it's
I like
it's
that
not
one, though.
yeah,
That's a good one.
but it's not just about ankles and feet. It's about all your joints. We're talking hands, wrists, shoulders, pelvis, spine.
That.
I mean, your spine has 24 vertebrae. There's 2 joints in every. That's 48 joints right there.
Right there.
That's a lot of joints. Now, we're just talking human joints here now, folks.
Oh, but
we'll do a whole show on other joints.
Cannabinoids.
Yes, we'll do that because that's a medical marvel as well.
That's an interesting topic.
We should do one on that.
Yeah, I do.
It's amazing.
Limonene, terpenes, all the different elements.
Yes. That's all I'm going to say. Now, so part of what happens with us is the ones that are on the couch never find something that they like. They don't like running. They don't like tennis. They don't like the gym. They don't like this. They don't like it. You got to find – the key to it is to find something you like. Okay. Oh, you don't agree with that. You want to push it anyway. Well, I believe in that, but I think overall –
I agree in pushing anyway, but to me it's kind of like this. Everybody thinks that you're only supposed to do things in life that you like.
Okay. I see where you're going.
And, it's some things you do because either it's the right thing to do or it's
like brushing your teeth. You do it because it is the right thing to do.
Going to school,
to prevent disease.
Things like that. Yes. Cleaning up your home, all that kind of stuff.
I see where you were brought up.
Midwest, what can I say?
No problem. I have no problem with where you're going.
But what I was going to say is that you may not start off liking it, but if you open your mind, you can learn to like so many things that you didn't think you like vegetables or what have you. You just have to open your mind, be open, and give yourself try things.
That's always a good thing in life is try new things.
And to give yourself to an experience. Like, you know what? I really wasn't raised, walking and biking, but I'm going to try it for a month and see how it goes. And you might really enjoy that high, that feeling that you get from your exercise of choice.
But you might not feel that initially.
You may not initially. It takes some time.
Yeah.
You have to kind of get through that initial kind of challenging period.
Phase. Yeah.
Yeah. So
you start
I wasn't
slow.
disagreeing with you, but I was just trying to enhance
I appreciate
the thought,
that. Absolutely.
Yeah.
So for those of you who need to find a simple form of exercise that you're good with, you don't have to look any further than to Google a list of sports, athletic events, etc. For people who are injured, we can talk. That's a whole different story.
Yeah.
When you're not injured, you have leeway to do just about anything you want to do.
How lucky!
But let's look at joints and life expectancy. Okay. So there's 2 sides of this coin. If you are overweight, things like running will put excessive force on certain joints, like your hips, your knees, your ankles, and so forth. Okay. But that's not necessarily what will bother them, because one of the 2 types of arthritis will bother any joint of your body at any time. So we'll just segue into that. Let's call it osteoarthritis versus rheumatoid. We can also include psoriatic arthritis or any of the other arthritides you want. So let's call one wear and tear, osteoarthritis, and let's call the other autoimmune. Okay? Mm-hmm. So let's talk. Okay, I'm pushing anti-inflammatory, right? If you eat an anti-inflammatory diet, which is what we've been describing all along pretty much, then it will keep the inflammation in your joints to a minimum, even if you are running or jumping or whatever.
Right.
Okay? If you don't, and you have rheumatoid, boy, you're going to trigger it. So the deal with autoimmune, everybody, it's not so crazy, all right? The issue is some triggers are firing it off, and you need to find what that is for you. And if you do that, you're going to live a lot longer, healthier, happier life without serious intervention. And I'm not saying it's a guarantee, but most people who find their triggers and are willing to deal with that are much happier. Okay, rather than say, the heck with it. I know I'm allergic to dairy, but I've decided I'm going to eat it anyway.
I love ice cream.
I love ice cream.
I'm going to eat it.
That's a big one, right? So now you got dairy and sugar going at the same time.
Or cheese. Cheese is another one.
And then at some point, now they need medication.
Right.
Because now the inflammation is gone. Yeah, now the inflammation has gone so far that they can't live anymore. Now they're screaming.
Right.
So the two types of arthritis attack different parts of your joint. And that's why this lovely little knee joint is here. And I brought this because it has blue menisci. So you can see that little hockey puck-like structure in there.
Can you tell us what's what? I mean,
Yes,
hear
I certainly can.
Lateral meniscus.
Earlier we
medial.
talked about the quadricep. So here's the quadricep tendon that attaches to the patella, all right, or kneecap, and then that attaches.
Circular bone up
yes,
front.
that's a little roundish shaped bone that then attaches into the tibia, and that's main support, main extension of the knee. There are ligaments that hold all of our joints together. The purpose of ligaments is to control movement. Purpose of muscles is to create movement. Okay, so you have a ligament on the inside called the medial collateral. You have a ligament on the outside called the lateral collateral. You got ligaments that go through called anterior and posterior cruciates. And these are the main structures that hold the knee together that then allow us to move. Now, the blue pucks here are called menisci. They're basically a cartilaginous structure which allows the movement. See if you can see it better this way. Which allows that movement. It's basically a glide path. For those of you who eat chicken, you'll notice at the end of the chicken bones is this whitish substance. That's called cartilage. And you have that on the ends of all your bones in addition to any menisci or discs in your spine or any place else. So all of our joints have a cartilage surface, and that cartilage surface can become eroded, which is what happens with osteoarthritis.
So can we regenerate that cartilage surface?
Now there's a topic for another whole show.
I know.
Okay.
I like that topic.
Yes, there are some things that do regenerate that. PRP and stem cell therapy, for example. Some people believe that there are other things that do as well. But basically, if you could get that knee into an exercise that is non-weight bearing, that increases the circulation, your body has a chance to do that healing. So cartilage is at the end of your bone. So let's just call that bone growth, if you will. I mean, you literally have to grow cartilage in your bone, and it's a very slow process. For everybody out there, you change your bone. Oh, there you go. Here's a picture of the types of arthritis. So osteoarthritis attacks the cartilage surface. We usually have a proliferation of bone. This is where that term bone spur came about. That's classic osteoarthritis. The body is saying, this is really stressed. I got to do something. I'm going to build more bone, try to make it stronger. Doesn't quite work out the way but that's the mechanism that it has.
Right. As
As opposed to rheumatoid arthritis, which does not destroy the cartilage, totally destroys the joint itself. Okay? And that's why rheumatoid is so painful and difficult to control, because it takes out all of your joints.
Do people who have rheumatoid arthritis, are they also at higher risk of things like fibromyalgia? Because that's kind of, immune system, some people think. Do you find there an association there?
It's definitely a neurologic event, the fibro. And I think there's very often corollaries there. Okay. Just like there are a myriad of autoimmune things. And once you're kind of in that category, they're right. Similar.
Right.
Some need to be treated very specifically. But okay, so osteoarthritis versus rheumatoid arthritis. I'll take osteo any day of the week over rheumatoid because it's more serious. It just is harder to control, harder to get pain free. Once you have no joint left,
what do you do?
That's a tough go.
Yeah.
As opposed to you got a little extra bone growing or a little cartilage that's running amok. That's easier to handle. We can control the pain of osteoarthritis routinely. Rheumatoid's a little trickier. Yeah. Okay, so hopefully most of you out there have OA, not RA. That's short for osteo and rheumatoid. Okay, so next, you got one more slide left there? Here we go. So here's how that same phenomenon affects the spine. You're looking at a view of a lower back vertebrae we call lumbar. And what you're looking at the very top, that bluish structure is a disc. That's a fairly healthy disc. And as you start to look down at the other blue discs, you'll see that they get thinner and thinner and thinner. And you start to see those osteoarthritic spurs coming off your spine. And the problem with that is that, and we're gonna tie this back into exercise in a minute. I'm going there. The problem with that,
I'm chomping at the bit on the exercise front. Yeah.
The problem with that is that now you've got spurs in places where nerves can be living.
Right. And irritate.
And if some of you out there are already saying, "Yeah, I know, I had one of those. Man, that hurt." It's significant because there's not a lot of room left once those discs dehydrate. So the degenerative process is also a dehydrating process. Mm-hmm. So how do we keep it from dehydrating? Exercise.
Indeed.
If you move it, it works like a sponging action. So here's the truth. After age 18, you have no blood supply to your discs. Okay? That's why our athletes are amazing when they're teenagers. Mm-hmm. Okay? They can do all kinds of crazy things, right?
And then they get injured in their 20s.
They can touch their toes with their nose. They can do all kinds of wonderful things.
And then by the time they reach 30, they're over the hill from an athletic standpoint, right?
Well,
everybody wants them to retire and all those things.
It's all about youth because of that fact. So
that makes me
if
sad.
you get the joint moving again, the disc will rehydrate. And sometimes you can do that on your own. Sometimes yoga is very good for that because part of yoga is trying to get all of the joints of your spine and other areas mobilized, okay?
Same thing about Pilates.
Absolutely.
I love Pilates.
Absolutely, but there's a lot more stretching with yoga. And so, yeah, I'm a fan of both.
Yeah. Well, the good thing about Pilates, I like yoga too, but the good thing about Pilates is, it's really, gravity is kind of taken out of it.
Mostly both are non-weight bearing.
Yeah.
Which again, we're talking a wonderful world. So anytime, so I guess we have to segue into injury. Okay.
Yeah, but yoga, you have to stand and put.
You don't have to stand. You can do it all on a mat.
And,
yeah.
You know what I mean?
I know what you mean. I've done both.
I've been in yoga class where I'm like, you know what?
All I can tell you is,
okay, is this good?
The older you get,
the
more stretching you need.
And that's what makes Pilates so amazing.
Absolutely. Absolutely.
Yeah.
So we're a fan of both. Don't get any ideas. We love it all.
Actually, what I really like?
See, she prefers Pilates. So she found that for her. That's what you need to do for you. You got to
find
what works for you.
But I like hot yoga too. But hot yoga.
Now she's complicated. She's backing out of that.
Bikram, I like it.
But First she trashed yoga. Now you're trying to say
trash it. But, I'm just saying, people need to understand that there's a little price to pay with yoga. Those positions, those poses, they can be a little difficult
you need to go
on the
easy.
joints and everything.
Especially if you haven't done hot yoga and you do it, you need to be careful because you can overdo it.
And you need to be in a room where it's
Good people will guide you.
Crowded.
Yeah.
Just remember I said that. You want a room where it's not crowded and everybody washed their clothes. That's all I have to say.
We're going to talk about cleanliness in a little bit here.
Oh my gosh.
So we started talking about joints, what happens with our joints. Obviously, weight is a factor, but not all factors, okay? Mm-hmm. Often we do things because we like to do it, which is what I think is appropriate. But sometimes it's not appropriate for our body.
Right.
So, for example...
Tennis.
Hey, don't go there.
That's how I hurt my knee.
That's it. I quit.
That's
I'm out of
how
here.
I hurt
She's
my
talking
knee.
about my favorite sport.
It's my favorite sport. That's how I hurt my knee. I can't. I am not allowed to play singles anymore. It broke my heart.
Doubles only?
Doubles only.
Well, you should come over. I love doubles.
Yeah. Okay. Yeah.
Absolutely.
Definitely. I love tennis, and I've played ever since I was like in the 6th grade.
Did you play
very
in college?
avidly. I didn't play in college. I was an engineering major. I was really kind of busy.
So you can play with us.
Okay, sounds good.
College players are too good.
But, I injured my knee, and I went to the wrong orthopedic surgeon because he told me you will never play tennis again. And I swear to you, I think I was clinically depressed almost for a month because it had been such a part of my life, and I love exercise and everything. I'm just like, what am I going to do? So I ended up talking to a relative, a cousin, who is a sports-trained orthopedist. And you know what she told me? She said, look, if they're not sports trained, sometimes regular orthopedic surgeons don't understand how athletes are. She's like,
because when you figure it out.
You figure it out. She's
Right.
like, you know your body,
Right.
rehab your knee. And so that's what I did. She's like, you can play doubles, but just rehab your knee. And that's what I did. I rehabbed my knee myself for like 3 years. I'm not kidding. I mean,
that's a long time.
It is a long time. I mean, but
Right.
I just wanted to be extra safe. I mean, I just strengthened it and strengthened it. I did all kinds of things, and my knee is great now.
And remember that if you have a foot problem that you don't know about underneath that knee, that perpetuates the knee problem.
Well, there you go.
So that brings up a subject of, what if it doesn't hurt?
That was me.
Okay.
That mine didn't hurt. It was swollen.
So how do you know if something's okay or not okay if it doesn't hurt? We wait. We kind of wait for pain to tell us.
But there's other signs. There's swelling, and there's also instability. And that's another thing that happened to me. We were looking at real estate, someone and I, and
we were talking about tennis here. How did we get on real estate?
My knee gave out because I played tennis earlier that day with a coach in Arizona who actually worked with, what's the blonde tennis player that everybody, Hingis? No. What's her name? Martina
Navratilova?
No, that's not her name.
She's a little older now.
No, not her. What was it?
On the tour now or not?
Anna Kournikova. It was
Okay.
her. So he had coached her when she was in rehab, for an injury that she had. So I was like, oh my gosh, this is my big opportunity to impress this guy. So I'm like running for balls and jumping and everything. Well, I hurt my knee. I didn't even know because it didn't hurt.
Right.
But we were walking up a hill and my knee gave out. And I'm like, what's going on here? And then it got really swollen, and I came back to L.A. and got an MRI, and I injured my knee. So you don't have to have pain. I never had pain. I didn't have pain, during my procedure, my recovery, nothing. I never had pain.
All right, here's a question for you. You're a surgeon.
Yeah.
How many times have you seen people with gallbladder disease that have knee pain?
Gallbladder disease with knee pain. I wasn't expecting that question.
Yeah, I know.
I don't think that I
because it's a common area for gallbladder on the right side of the body for both the knee and the shoulder to be a problem with gallbladder diseases. You haven't seen that. I've seen a ton of
Now,
it.
shoulder pain is actually referred pain because of the way that the nerve fibers work, or sometimes people complain of back pain, lower back pain with either cholecystitis, which is inflammation of the gallbladder, or you're right, or the pancreas. They'll say, "Oh my gosh, I've been having this terrible back pain." Gosh. It's because those organs are kind of toward the back of the body, right? And so they irritate the nerves in the back, and then it gets transmitted as back pain. Your body can't say, hey, look, the gallbladder hurts. It's like something hurts in this area. So, but I haven't heard that connection. That's interesting. Very common. Now I'm going to have to ask everybody. And I just discharged somebody today that I took out a gallbladder on a couple of days
ago. How's your right knee doing?
Really? Like, by the way, is your knee okay? I'm like, what's wrong with her? It's strange.
So we can be affected by organic things is kind of what I was trying to get at there. Stress creates all kinds of organic problems, which then can relate to inflammation anywhere, whether it's the knees, the back, the neck, whatever. And that's a whole other sympathetic adrenal deal with the saber-toothed tiger again. But let's go back. Let's kind of finish up here. We started talking about joints. We started saying inflammation is the devil. We started talking about the diet again. We looked at two types of arthritis, okay, that it could affect any joint of your body. And if you're going to, and if you have a injury, it will further inflame the new injury, okay, and that you could be prone to certain injuries because of inflammation, okay? And
on top of that, you made that connection between the foot
yes.
and the knee, and I'm kind of fascinated by that.
So our foot is so important. It's our connection to the earth. Mm-hmm. And I know that sounds hokey pokey, but here's the reality. When your foot hits the ground, you have electrical sensors in your feet and ankle joints that tell your brain what you just did. Okay, better than those little robots that clean your house. Okay? When that foot hits the ground, your brain says, turn this muscle on, turn that muscle on, and all in synchronicity. It functions and turns on 27 muscles.
Wow.
So if your foot's off, chances are some of those muscles aren't going to fire correctly.
Okay.
So if the foot's not firing correctly, now you're asking the knee to compensate. So it's going to twist, rotate, or do something that it really doesn't like. And after a while, that lack of synchronicity and proper movement creates inflammation in the joint, and it blows up eventually.
Interesting.
So that can happen. Okay? I'm not saying that's always the answer, but it's very frequently the case. And when I rehab a knee, I always look to the foot first. Okay.
Is there a way to map like the biomechanics of that? You know, if somebody says, you know what, I'm having this knee problem, I wonder if my foot is, you know, related to this. Like, can you go on a sound stage or something, and you know how they put on those suits and they do for the CGI or whatever that is for animated films? I mean, is there a way to really map out the biomechanics of that relationship? How do you do that? Can we come to you and you do that?
Absolutely.
Or is there somebody?
Absolutely. Okay. Anybody who's trained in gait analysis can do that. Anybody who's doing sports work, chiropractor, physical therapist, osteopath. I mean, I've even seen some massage therapists who are good with gait mechanisms. So it's a specific training.
So then once you get that gait analysis,
how does it function? When your foot hits the ground, what's supposed to activate first? What happens second, third, and so forth? Yeah. And is it working?
So that's what you get out of it.
And if not, why not? I mean, the beauty of kinesiology is I could actually test muscles, and I can see what's working and what's not. You know, I find that invaluable.
So if I'm listening to this, to these two people talking, you know, saying these things, and I'm thinking, hey, I'm going to go out and find somebody who's gait trained, right? I'm going to find someone who knows gait analysis. What are there like 3 key things I'm looking for? Is it a report? Is it, you know, like what am I looking for? Well, you know, for that analysis, because I think that's important. It sounds like there's some people who have.
There are many ways to do it.
Foot issues.
One is to observe the patient walking. Many people have that training. That's probably the most universal. Okay. Because that's the simplest. Right. Some docs now have computerized gait analysis where they have you step onto a sensor pad that's connected to a computer that can tell you, you know, where your weight bearing is off. Okay.
I like that.
I like it too, but I have found. So we have so many variations. Like, you know, some people have their nose bent to the right, and there's no problem with that. Right. Except maybe it's closing off the left nostril a little bit or something like that. But there's nothing wrong with it. Yeah. We're not symmetrical perfectly. Yeah. We're always a little bit different. And so what I find most important is function and strength. If you can be flat-footed and be completely perfectly functional and normal.
That's good to know.
Okay. And you can be flat-footed and have no function at all. Right. So that's why I love the ability to actually test the muscle to see what's not working. And so I base my work on that, and I base all of my foot orthotics on that and normal non-weight-bearing theories.
How do you test the muscle?
Manually. It's easy.
I see.
Super easy. Okay. Yeah. I train doctors all the time to do that. Once a month I do relicensing seminars for docs.
Really?
Yeah. So
everybody check this out. Yeah. I mean, this sounds like a great seminar.
It's so easy to do.
What is it called again?
Well, that's for chiropractors only.
Oh, for chiropractors. Yeah. I was going to say, you guys sign up for it. Sorry. Well, there's chiropractors probably listening. Sign up for this course.
I was thinking about, you know, branching out and doing my own seminar, but I've got so many other things that I'm doing that putting a seminar together is a lot of work.
It's a lot of work. Trust me. I've done it. Yeah.
And you have to have staff, et cetera, Excellent. Et cetera. So right now we're doing some other things. You've seen my foot para unit that I had to design because people have horribly weak feet. Do you remember that unit? I brought it in. No? Drawing a blank there. Okay. So basically what I found was that foot strength went bye-bye because we're in shoes all the time, in which we have no longer have the ability to grasp the ground, called plantar flexion. Okay. We're in flat shoes that prevent that motion. We walk all day long, which does just the opposite motion all day long. We were meant to be barefooted, and we're not anymore. So we've lost that ability. So
barefoot for how long, though? I feel like it's barefoot for 30 years, whereas now we're living until 80. So, you know.
Well, let's not even go there. The reality is that there was nothing available in the gyms anywhere in the world to strengthen your foot. Yeah. And my specialty was nerve damaged feet. Oh, so after I mean, I could help them with their pain, but I struggled initially to get the function back. So I actually created and patented a device that strengthens the bottom of the foot, restores the arches, and creates function again. and these people have better balance and can walk again, et cetera, et cetera. So I'm busy with that project this year.
That's pretty cool.
Yeah.
Is that something people take home, or they come in and get a treatment?
Well, they could do it either way, but
Nice.
most people, need to do it on their own, and then they have something at home for the rest of their life.
That's pretty nice.
Hopefully in a couple of years, all the gyms will have it, but right now they don't. We're in that early stage, but I think that it's going to be super valuable to hundreds of people who didn't know they had a problem.
Yeah, I think so too, especially for, there's so many women. I mean, I used to live in New York, and, New Yorkers, high heels and walking 20 blocks. I mean, 30 blocks, you do it all day, every day. I mean, that's what I did. I mean, high heels for, all that. And it's pavement, it's not even like it's
biomechanically.
Nice, it's horrible.
Horrible.
Yeah. But that's a big
And if
New
you didn't
York
have
thing.
a problem before, you probably would after.
Exactly. It's a bad thing.
And how many women can wear high heels at 60?
That's an interesting thing. You start to see people in these more quote unquote sensible shoes. But I think I think there's kind of like a revolt now, against all of these uncomfortable shoes in general. I'm seeing a lot of people say, you know what, I cannot.
Because it affects so many things in their body.
It really does. They're like,
Exactly.
I just can't do it anymore,
Exactly. So we talked about what happens to your joints. We talked a little bit about the spine too, and how it's all about hydration. So if your body is dehydrated, it's pretty hard to hydrate your discs too. So hydration is important. We've been talking about that all along. Now you know why. Okay? Because it's not just water. It's minerals. It goes to all of your body parts.
So what about things like MSM and chondroitin?
Some of those things are very valuable.
Are they?
And my only comment about that is if it's going to be helpful, you will notice it within 2 or 3 months. I have people who come in, I've been taking it for 3 years. How's it working? Then stop it. If it's not, it should be working in 3 months or it's not going to work for you. Cut it out. There was actually some studies that showed long-term use of that was not necessarily healthy.
So are you supposed
doses.
To use it for a certain period of time?
Try it. If it works, continue to use it, but rotate it in and out. I believe in rotation, just like a rotation diet is great for you as well.
And so what does it mean that it works?
Well, it should reduce inflammation. Okay. You should have less pain in the joint.
Okay.
That kind of thing.
Okay.
Some people believe that it's helping to grow cartilage or whatever. That's fine. If it does, great. Wonderful. It's always a blessing. Hyaluronic acid is good for that. Anything that reduces inflammation is good for that.
Okay.
Anything that helps bone density is good for that, and not just calcium out there if you're thinking about that. Vitamin D is important. Many, 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 things that, we used to think simplistically. Magnesium is good for muscle spasm.
Yeah, it's one thing.
Okay.
Yeah.
Magnesium does 1,000 different things in our body, all over it. Okay.
Right.
So, God gave us these beautiful muscles. You need to use them, is my point of view. So, you've heard this before. If you don't use it, you lose it. And that's really true with muscles. Here's a stat for you. I'm not big on stats because I think sometimes it scares people or misleads people, but here's one. If you lie down in bed, after 30 days, you will atrophy at a rate of 1% per day. So in 3 months, you've got no muscles left. Okay?
That's comforting.
There's a reason alone to keep your body moving.
Right.
But a lot of people, and we've trended out of that. Years ago, we used to say, "Oh, you need to be in bed." Well, some bed rest is important, and you know what the appropriate amount is after your surgeries, et cetera.
6 hours and then get out of bed.
So there you go. Even after surgery, guys.
Get out of bed.
A major injury, maybe 3 days.
Yeah.
Okay. Super big, maybe a week or two, but that's it. You got to get your body going. And so bicycle is a good way to get the body going. Bicycle is really good for your knees, by the way, because, again, it's non-weight bearing and it's using all of the faculties there. And by the way, all of you who have bikes, I love the straps over the toes because a lot of you aren't aware that without the strap, all you're doing is pushing down. With the strap, you're pulling up. So you could actually do 360 degrees of movement of the entire leg.
The benefit of those straps.
Exactly.
I wondered about that. I wondered about that.
You get different parts of your leg. You get more power. You get more consistent power. You can go up hills better.
Yeah.
The first time you do it, you'll go, holy cow, I didn't know that there's other muscles there.
Yeah.
Instead of just pushing down, pushing down, pushing down. Okay.
The water is pretty good for joints as well.
Aquatherapy is amazing as another non-weight bearing exercise. I'm a big fan.
Yeah.
There aren't too many facilities around, though, that have a heated pool adequate for some people.
Yeah,
and some people
true.
are sensitive to chlorine, et cetera. There are a few hot saltwater pools that are amazing around town.
That actually sounds pretty nice.
Yeah, they're really great. And they have great instructors, too. Yes, I'm a big fan for that.
I've only done it once.
Right.
It was in Hawaii. I was on vacation, and I went to visit a resort, and they were having a class. And I said, well, let me just try it. So they give you gloves.
She tried new things, guys.
I always
you got to try
something
new things.
new. I like exercise.
And when you find something that you like, keep it.
Yeah. They give you these gloves. They give you like these little tubes that you get all these things, and you do different routines and movements. There's even a race in the pool. Okay, run to the other side of the pool. Run. And you think, oh, that's not hard. That's hard. And you are really sweating in there, but you're not aware of it because you're wet. And it's a great workout. I felt so good. My heart was beating, and I just felt great after that.
It's a wonderful thing.
And then they had a wonderful saltwater jacuzzi that I got in afterward. Oh, it was amazing.
The dip.
Oh, my gosh.
So, again, that's another great way to get your body moving.
It really is.
So if you're out there and you're thinking to yourself, geez, I don't know what to do next. I don't know if my spine's moving. I don't know if my knees are working. I don't know. Just start with the most gentle thing that you can find. And my suggestion is things that are close to your home or work are usually preferable, because if it takes you too long to get to any place, you're not going to do it. And that's the most important thing.
And I think it's good to keep a bag in the trunk. A lot of people, think, oh, I'll just go home and change. But let's face it, once you get home, either you have things that you have to do. Oh, my gosh, I need to clean this up or answer this call. Or, you're just like, well, maybe I'll go out in an hour, right? You just get kind of rooted. So, when I lived in Chicago, what I used to do is keep my workout bag in the trunk of the car. And then on the way home, I'd fight through a certain part of my traffic, and then I would get downtown Chicago in the Loop.
Did you also change in the staircase along with eating your lunches?
I actually had a decent health club that I belonged to with my own locker. So I went in and
you were like Superwoman.
I'm not going to tell you the people that belonged because, that's name dropping. But it was a decent club. But anyway, I would stop off there on the way home rather than sit in traffic. I mean, why not get a workout in rather than just sit there in traffic?
Oh, absolutely.
And then you grab dinner and then commute home. I mean, so many of you spend all this time in traffic. You commute 2 hours, hour and a half.
Right there.
Yeah.
If you work out, you can eat more.
That's why I work out.
If you work out, you can eat carbs and still burn fat.
You sure can. I'm telling you.
There is your best reason for working out.
Yeah. Okay? I have a great appetite. And, when I'm not working out as much, then I can feel it. But anyway, rather than to sit in traffic, just go work out 30 minutes. It can change everything.
So I just had a thought.
Yeah. Let's hear it.
I want everybody, when we're done with the show, to walk over to a mirror and look at themselves straight on in the mirror, turn their head all the way left and all the way right, and then try to tilt their ear over to their shoulder on both sides.
Okay.
If you can't move more than you have a problem.
Indeed.
Oh, but it doesn't hurt. I understand. You've got a problem because you're losing range of motion.
Decreased range of motion.
And this is the first thing that we start to see when something is dehydrating. Your joints are going to start locking up a bit. The muscles are going to react to that, and you're going to lose range of motion. So anybody who's trained to just check range of motion can help you with that, whether it's a chiropractor, physical therapist, osteopath, etc. Okay?
What about
maintaining our range of motion maintains our joint mobility as well.
What about touching the toes?
So the only caveat to that is for us people who have very long legs, and that's 2/3 of our body, touching their toes is a lifelong challenge.
I'm hearing an excuse here. I don't know.
I'm just giving you – some of us are engineered a little bit differently. Some of us have very little flexibility, and we're born that way. I'm not saying I'm that, but I've handled hundreds of those cases where I ask somebody, okay, bend forward, try to touch your toes, and they're like 1.5 feet away. and they can't bend their spine to do that either. It's just like their neck starting to bend forward. So that's a lifelong issue. They've waited too long. They should have been in stretch class, and everything long years ago. If you wait too long, you can't fix things as easily. So we're back to that take care of it along the way process. in the same way that when you take your car in for its maintenance, if you do it on time, everything works great and the fees are predictable, okay? If you don't do your services for years and you take your car in, not only is it unpredictable, but the fees are going to be astronomical. That's exactly how it is with us.
There's a price to pay.
Only we're not, all mechanical. Right. We have our chemical, spiritual, et cetera, sides to us. But we have a physical body. We need to take care of our physical body in any way that we can, including eating well for it.
I have a friend who is like 60 years old, this guy almost. He works out at least 5 times a week. Uh-huh. He's been doing this probably for 40 years. Okay. He looks phenomenal. He can eat anything. He's actually a healthy eater and everything. Not crazy healthy, but you know what I mean. Yep. But he either takes bike rides, he works out in the gym. He says, I have to do something. But he said that over time, things change. Like at first he used to do arms, legs, whatever.
A different body part each day.
He can't do that anymore because he feels like he's losing something. So he does a little bit of everything and then focuses on one. So to do that to keep things going. But I'm just telling that story to say, it's just this lifestyle. This is just what he does.
There are many different things that work for different people. Yeah. From a personal note here, I do my whole body twice a week. I mean, the whole body.
Nice.
I just don't overdo any one part, but I get it all because I've only got 2, at most 3 opportunities in a week to get it all.
Right.
So instead of doing, 12 sets of shoulder work, I'm going to do 2, but I'm going to also do my whole body. I find that as you get older, doing opposite body parts is much healthier. You walk out much better balanced. Guys out there, I know you love to do chest presses, but if you don't do back exercises on the same day, eventually that's going to catch up with you.
You got to
That's kind of the theory there. You really need to work balanced as you get older, and you stay much better balanced, much healthier, less injuries, less muscle cramps, spasms, etc., and it just works better.
So if I'm a 22-year-old listener.
You wish.
And I remember being 22 and having this all my friends around me were working
22.
out. I remember this.
I remember
graduated
22.
college.
Wow.
All my friends, we were working professionally in Chicago, and all my friends belonged to the health club. And I did not understand it because I had always been athletic. And I was still playing tennis and all that. And I'm like, I don't know why you're going to work out. Like, I did not understand at that time.
Because you think they didn't need it. Was that what you thought?
I just didn't because I knew I didn't need it because I was already active. And so if you're 22 and, you have that question, like, what would you tell a 22-year-old who's like, look, I'm in great condition. I don't really need to work out. Now, I'm just going to tell you, like 1 or 2 years later, I joined a health club and I started working out because I was working professionally and I couldn't do it.
The issue there is you first got to find out what that person's goals are. Because you can't tell a person who doesn't want to do something.
But this is the prevention part.
No, I get it. I get it.
Yeah.
The concept of cross training is a good one.
Okay.
So
cross training.
I'm an avid tennis player. I can't stay on the tennis court without hitting the gym. Can't do it.
Right.
And if you show me a top professional in any category, they're hitting the gym. They have trainers. They have special people working with them to keep them in shape to do their sport.
And to have stamina.
Yeah.
Right? And strength.
Right.
You need the stamina and the strength in order to do that activity that you love. So there's a lot of work behind being, an NBA, NFL,
hell yes.
lacrosse, whatever the sport is.
You have no idea.
You have to really work out. They're not just out there like, oh, it's Sunday or whatever the day of the week is and I'm doing my part. So you have to prepare.
Unfortunately, we're getting down to that spot again, aren't we?
Yeah.
I think we got 1 minute left, yeah?
It's good to have fun with the topic.
I hope you enjoyed that part of it. So we're still back to the same concept, health from the inside out. You got to take care of yourself. And if you do that, then your joints are going to be happier. You're going to have more energy, more vitality, a bigger smile on your face, etc. You're going to be more optimistic. Good things will happen to you. Just think about who you want to meet. You want to meet somebody who's alive and moving and happy and smiling? Or do you want to meet somebody who's kind of a downer and doesn't exercise and they hurt and they're complaining all the time about what's going on? So think about that. Again, website is the best way to get a hold of us. DrKelberman. It was at the bottom of the screen at wwc.care. We're happy to pass along any additional information. As always, I want to thank my phenomenal co-host, Dr. Cutter.
Welcome. And don't forget to vote, because today I voted.
And we'll see you in 2 weeks at Health from the Inside Out.